Okay, here's something to think about. What if improving health wasn't just, about hospitals and doctors, but maybe also about how our cities are designed or how we get to work, even our education system?
Right. It's a pretty fundamental shift in
It
perspective.
really is. And that's the core of today's deep dive. We're exploring health in all policies, or HiAP. Now, this is a global initiative, basically, where governments try to coordinate action across all their departments:
Mm.
housing, transport, education, environment.
Uh-huh. Not just the health department.
Exactly. The big idea is to tackle those broader things that affect our health, the sort of root causes, and reduce inequalities.
It's a really ambitious goal and a great one. But here's the tricky part. We see lots of these HiHAP initiatives happening, but honestly, we often lack solid research on why some really take off and succeed, while others, well, they just sort of fizzle out.
Right.
It's tough to generalize because each situation is so different. So today, we're going to unpack a novel methodology that researchers are using. It helps uncover the sort of hidden gears, the mechanisms behind successful implementation. We're diving into how researchers are getting to the how and the why these policies actually work on the ground.
Okay, you mentioned this earlier, this idea of an open change process.
Yeah.
It sounds complex. If every situation is unique, how on earth do researchers find common ground? Or learn anything useful? It sounds like a bit of a nightmare, frankly.
It really can be. It's a bit like trying to figure out exactly why a specific recipe works perfectly in one kitchen but flops in another, even if you follow the instructions.
Yeah, okay.
The ingredients might look the same, but maybe the oven's different or the altitude or even just the cook's technique. There's hidden factors. That's the challenge with policies, too. So the proposed solution here is what's called a realist explanatory case study. It sounds a bit academic, but the idea is simple. It goes beyond just describing what happened. It aims to uncover the social mechanisms, these often hidden interactive processes that are actually driving success or failure.
Social mechanisms, like
Yeah.
what exactly?
Think of them as the underlying reasons why people or organizations react to a policy in a certain way. It could be existing relationships, unspoken rules, beliefs, resource flows, stuff like that. The researchers talk about context mechanism outcome patterns, or CMOs. The idea is that certain mechanisms only get triggered or activated within specific contexts.
Okay.
And depending on that context in which mechanism fires up, you get certain outcomes, like whether people accept the policy, whether it's feasible to implement, or if it actually lasts.
Right. That makes sense. Context triggers mechanisms lead to outcomes. Let's make this concrete, though. You mentioned our source material looked at health impact assessments, HIAs, in Sweden and Quebec.
Exactly. Great examples. Let's start with Sweden. Now, over there, using HIA tools isn't actually required by law, it's voluntary. And researchers found its use was often held back because, frankly, people didn't fully understand it, and there wasn't always the money or staff capacity. But, and this is key, a success mechanism emerged. HIA became much more acceptable, much more feasible, when it could be easily slotted into existing structures people already knew.
Like what?
Like environmental impact assessments, EIAs, those are mandatory in Sweden since the 90s. So when HIA wasn't presented as this totally new thing, but more like, let's just add a health perspective to the EIA process we already do.
Ah, so piggybacking on something familiar.
Precisely. It used existing procedures, existing staff knowledge, that made it way easier for sectors to swallow. That's a mechanism, let's call it conformity or integration firing, in that specific voluntary HIA context.
Okay, interesting. So how does that compare to Quebec, then? You said it was quite different.
Very different context. In Quebec, the Public Health Act of 2001 actually mandates HIA for certain government proposals. It's not optional.
Big difference right there.
Huge. And they didn't stop there. They set up a really detailed step-by-step process involving multiple ministries. They even have dedicated support teams to help ministries actually do the HIA, find the evidence, and write the reports.
Wow, okay. So much more structure, much more support built in.
Exactly. So think about the implications. This comparison really shows how that context, voluntary versus mandatory, using old structures versus creating a new detailed process, totally changes which mechanisms are important.
So in Sweden, that conformity mechanism, fitting HIA into the existing EIA framework, was crucial for getting it off the ground because the context was voluntary.
Right. But in Quebec, with that strong legal mandate and the built-in support structures, the need for that specific conformity mechanism, it wasn't nearly as critical. The context provided a different pathway.
It really highlights that just copying a policy from one place to another probably won't work unless you understand these underlying dynamics.
You hit the nail on the head. This realist approach helps us understand what works, for whom, in what kind of setting, and critically, why. It means we can be smarter about adapting successful strategies, not just blindly copying them.
It makes adaptation the key, not just adoption.
Perfectly put. Success isn't just about the policy itself. It's about that dynamic interplay between the policy, the context, and the mechanisms it triggers.
So this really brings up a question for you, our listener. When you look at policies or new initiatives, maybe in your own community or your field of work, what are those existing structures, those mandates, those unspoken rules, the context that might help or hinder something new? How could understanding these underlying social mechanisms actually change your approach to making things happen? Something to think about, moving beyond just the what of a policy and really digging into the how and the why it might succeed or fail.